the risk factors of this condition, they include smoking and having more than one sexual partner, douching, and black race. Now, the woman will complain of a vaginal discharge, which is usually offensive, and it has a very peculiar fishy smell. The discharge is homogeneously off-white in color, and if you check the pH of this discharge, it will be high. Now, diagnosis of this condition, which is bacterial vaginosis, is made by following Amsell's criteria. And what is Amsell's criteria? There are 4 observations, and if a woman fulfills 3 out of 4, then she is termed as having bacterial vaginosis. So these 4 criteria, they are presence of homogeneously off-white discharge, high pH, more than 4.5. Then remember, if you take vaginal discharge, add saline, and examine it under the microscope, there will be presence of clue cells on microscopy, and a fishy odor when you add potassium hydroxide to a sample of discharge. So these are the 4 criteria, which is not only causing vaginal discharge, but it is also associated with a number of pathologies, both during pregnancy as well as in a non-pregnant state. During pregnancy, it is associated with even recurrent miscarriages and preterm births, and thirdly, pre-labor rupture of membranes. So if somebody is diagnosed to be having bacterial vaginosis during pregnancy, she should be treated aggressively. Why? Because you can end up with any of these complications. Then in the non-pregnant state, it can cause pelvic inflammatory disease, and women with bacterial vaginosis, they are also at an increased risk of HIV. So how will you treat it? Treatment is both orally or vaginally. So you can prescribe metronidazole, that is one drug, and secondly, clindamycin. Then the other infection can affect the lower genital tract is vulvovaginal candidiasis. Can you hear me and you are connected?
Yes, ma'am.
Ji? With me or not? आ रही है? Acha. To that is vaginal candidiasis. You must have heard about candidiasis because this is a fungal infection and it can affect, besides vulva, other parts of the body as well. Now, this is caused by a yeast which is Candida albicans. And this organism or this yeast, it causes both vulval and vaginal infection. Some of the women, they may be asymptomatic. And this is common infection which is seen during pregnancy. In fact, it has been found that about 40% of pregnant women, they may experience vaginal candidiasis during pregnancy. Now the symptoms, what are the symptoms? Symptoms are, first of all, vaginal discharge. And this is a very peculiar vaginal discharge. It is thick, curdy white. And if you have seen a woman once in your lifetime with vulvovaginal candidiasis, you can never forget because the discharge is so specific. Then the woman will also complain of itching, that is called pruritus fulvi. When you examine the woman, there will be obvious signs of inflammation. And what are they? There will be redness, erythema, edema, and most important, there will be cracks or fissures on the vulva and vagina.
मैम अभी काफी बच्चे लॉबी में हैं.
लॉबी में हैं?
यस मैम.
क्या ये कुछ बच्चे लॉबी में? जो लॉबी में थे वो एंटर हो चुके हैं जी. So, coming on to vulvovaginal candidiasis, back to it. Now, this infection is more common in diabetics, in women who are immunocompromised, and it is seen commonly during pregnancy. As I've already told you, that almost 40% of the pregnant women, they may experience vulvovaginal candidiasis at some time during pregnancy. So there is thick, curdy vaginal discharge, thick, curdy, white vaginal discharge. There is itching, irritation on the vulva, even in the vagina, and obvious redness, inflammation, edema, erythema of vulva and vagina. So the diagnosis is mostly clinical, but you have to confirm it by certain tests. And what you do is that you take a vaginal swab for microscopy and culture and confirm it. Then what is the treatment? Treatment is oral as well as vaginal. You prescribe topical intravaginal pessaries, and you can also give oral antifungal agents which are imidazoles. So the vaginal pessaries or the vaginal cream, that is advised for at least 7 to 14 days. And similarly, the oral treatment is also for a week or 10 days. And remember this is not a sexually transmitted infection, so you don't require the partner should be treated. The next infection is trichomoniasis. This infection is caused by a protozoa, which is Trichomonas vaginalis, and in this trichomoniasis is also causing, similarly as in vulvovaginal candidiasis, vaginal discharge. And signs and symptoms of vulvovaginitis. What is seen is that in about 50% of women, the infection is there, but it is asymptomatic. And this infection, it is sexually transmitted. So when you diagnose trichomoniasis in a woman, it means that you need to treat the partner as well. Now, as we talked about venereal vaginosis, that it is associated with certain complications during pregnancy. So similarly, there has been some association of trichomoniasis with pregnancy outcome. And some of the complications that can occur are preterm birth or preterm labor. And with preterm birth, the instance of low birth weight babies will also increase. And it has been found that it is also associated with postpartum sepsis in the mother.
मैम बहुत बच्चे कह रहे हैं हम अभी भी लॉबी में हैं, हम नया जो लिंक आया था उसमें ऐड हुए थे, तो अब हम पुराने लिंक की तरफ आए लेकिन हमें ऐड नहीं किया जा रहा।
कौन ऐड नहीं हुआ?
5 बच्चे हैं, वो कह रहे हैं हम लॉबी में अभी भी।
अब देखें, अगर वो आधे घंटे बाद आएंगे तो फिर तो वो ऐड नहीं हो सकता। क्यों नहीं वो टाइम जो है?
मैम हमें ना न्यू लिंक भेजा गया था क्लास का, तो वो उधर गए थे। अब हमने बताया तो 9:15 के, वो कह रहे हैं हम वेट कर रहे हैं लेकिन अभी इस क्लास में ऐड नहीं किया जा रहा।
नहीं, वेट क्या है, वो तो मैंने पास मेरा पीए बैठा हुआ जो एंटर कर रहे हैं। अभी अगर इतना लेट आएंगे तो फिर है कोई? इसलिए अब बार बार बीच में डिस्टर्ब ना करेंगे। अब आ गए लॉबी में, अब आ गए, अब गौर से लेक्चर सुने अपना। So you need to do the test in symptomatic women. And the gold standard test here is nucleic acid amplification test, which is done preferably on vaginal or endocervical swab, but it can also be done on urine. And it has a specificity of about 95%. Microscopy and culture of the vulvovaginal swab, that can also be done. And the treatment is metronidazole, which is given orally. 400 milligrams 3 times daily for a week. And similarly, the male partner should also be prescribed. Otherwise, he will have recurrent trichomoniasis if the male partner is not treated, as it's a sexually transmitted disease. Now, the other two infections which cause not only cervicitis, but also pelvic inflammatory disease. And pelvic inflammatory disease is infection of the upper genital tract, involving the uterus, fallopian tubes, ovaries. So these two infections are gonorrhea and chlamydia. And they have certain similarities. Both these infections, they are not only involving the vulva, vagina, or the cervix, but also urethra. So, talking about gonorrhea first, this infection is caused by a bacteria which is called Neisseria gonorrhea. Again, it's a sexually transmitted infection. And as it's a sexually transmitted infection, it means the male partner must also be treated at the same time. The woman will complain of vaginal discharge, that is the commonest symptom, along with abdominal pain. And again, some women, they will be asymptomatic as well. But if symptoms occur, they are usually vaginal discharge and lower abdominal pain. Then a rectal infection can also take place. Why? Because it is in close proximity to the lower genital and through transmucosal spread, rectal infection can also take place. Similarly, there may be pharyngeal infection. So, and what is the appearance of this discharge? The mucopurulent. If the woman is symptomatic, then the discharge is usually mucopurulent. The associated cervicitis. And as I've already told you, untreated, it ascends upwards, leading to inflammatory disease. Pelvic inflammatory disease occur. It has been found that where there is hematogenous spread, and when hematogenous spread leads to disseminated gonococcal infection. And when there is disseminated gonococcal infection, it will give rise to a body rash. There may be arthritis, arthralgia, which is monoartic in weight-bearing joints. Now, if gonorrhea in labor and he delivers vaginally, can also acquire infection. As I gonococcal infection is also causing cervicitis endocervical. So if the mother delivers with an cervicitis endocervical infection, the infection can be transmitted to the neonate. Are you testing? As I've told you, in case of trichomoniasis, the gold standard is nucleic acid amplification test. So this is also prescribed for gonococcal infection and specificity. Again, taking a sample of swab charge for culture and safety, that is also important. Now remember that as it is involving pharynx, it may involve the pharynx, it involves the anus as well as the vagina, it may involve the rectum. So you have to take swabs from all these areas, from the pharynx, from the cervix, from the vagina, as well as the rectum. You have to take swabs from all areas, then do this gold standard test or that. This infection treatment is in the parenteral form using a third generation cephalosporin along with azithromycin. You have to give a combination cephalosporin along with azithromycin. Cephalosporin in the injectable form, you can give azithromycin in the oral form. And remember, it's a sexually transmitted infection, so the partner must also be treated when a woman is diagnosed with a gonococcal infection. So, gonococcal infection is not only confined to the pelvis, it also gets transmitted, it may get transmitted through the cervix to the genital tract, from there it may lead to hematogenous spread involving the joints. So it can lead to a widespread infection if it is not aggressively treated. Now the last, the chlamydia. Chlamydia infection is another sexually transmitted infection, and it is seen commonly in young women below the age of 25. It is caused by organism called Chlamydia trachomatis, and as in gonorrhea, where 50% of women may be asymptomatic. Similarly, women with chlamydia, they also may be asymptomatic. But when it causes symptoms, again, symptoms are vaginal discharge. Here, the woman may experience regular bleeding, which may be intermenstrual or post bleeding. So, on examination, there may be mucopurulent discharge, and again, there chlamydia also can cause infection other sites, but here severity is less as compared to gonorrhea. Again, as gonorrhea can cause infection of the monoarticular joints, affecting the weight-bearing joints. So there are certain similarities between gonococcal and chlamydial infection. Similarly, as I told you about trichomotor cases, in chlamydia also, if the woman has active infection at the time of labor, then this infection can be transmitted to the neonate. Again, the test which is being done is the tract test. You take a swab and do nucleic acid amplification test, which has a very high level of sensitivity and specificity. Now, the treatment of this infection is erythromycin, or you can give doxycycline, which is a tetracycline. Now, azithromycin was being used in combination with third generation cephalosporins in case of gonorrhea. But here for chlamydia, is it azithromycin or doxycycline would be sufficient. But again, male sexual partners must also be treated. Otherwise, the woman will have recurrent infections. Any questions? Please, students, are you with me or not? Yeah.
Yes, ma'am. No, ma'am.
Okay.